Garden to Plate project is actually working with 300 women in around 11 communities. In those communities, we had found something like 200 people living with disabilities due to non-communicable diseases. And you'd know that 80% of the children below the age of 2 are known to be anemic under the National Nutrition Survey, and something like 50% below the age of 5 are anemic. So we are asking the question, why is nutrition such an issue when we are surrounded by abundance of food around us?
We are trying to help our farmers to do collections of our own local materials. So we have we call germplasm centers around the provinces that we did collections, and then we are now will be running a diversity fair or farmers show that farmers will come and do the evaluation of our own local collections, and then we will find out what is superior or best variety of our own, and that will be given to farmers.
Pulavinaka Maori, Talofalava Maloelele, and good evening to our partners in the Pacific Islands, and good morning to our partners joining in from Europe. My name is Jana Dietershagen, Technical Officer at the Technical Center for Agriculture and Rural Cooperation here in Wageningen, the Netherlands. I'm joined here this morning today by Judith Francis, Senior Program Coordinator and leader of the Promoting Nutritious Food Systems in the Pacific Islands project. Today we will have the first of 2 webinars on evaluating the role of community food production initiatives for improving nutrition in Pacific Island states. I'll just give you a quick outline of the webinar. Judith will give a 10-minute introduction to the project and background. Nigel will speak on the evidence base. Then we have the first Q&A session, and this will be followed by a presentation from Emily on food sources and diet quality. Then we'll have our final Q&A and closing. Our webinar panel for this week and next week is Judith Francis from CTA. We have Morgan Viro, Director of the Pacific Center for Environment and Sustainable Development of the University of South Pacific based in Fiji. William Iese, Research Fellow, also at the Pacific Center for Environment and Sustainable Development of USP in Fiji. We have Nigel Unwin, Clinical Director of Research in Global Public Health and Epidemiology Unit of the University of Cambridge and Professor of Diabetes at the European Centre for Environment and Human Health at the University of Exeter, and also Emily Hayes, Postdoctoral Research Associate at the European Centre for Environment and Human Health at the Medical School of University of Exeter. I'm handing over in a second to Judith, who will introduce to you the background of the Promoting Nutritious Food Systems in the Pacific, or shortly called INNOV4AG Pacific project, which is operating in 7 countries in the Pacific. And she will tell you more about our initiatives on the community seed funding nutrition projects as well.
So the INNOV4AG Pacific project is a 4-year project, and you would see that we cross Micronesia, Polynesia, Melanesia. We focus on 7 countries: Fiji, Kiribati, Marshall Islands, Samoa, Solomon Islands, Tonga, and Vanuatu. And you'll hear more of this in Nigel's presentation. So the goal of our project is to strengthen the capacity of Pacific Island governments with a focus on developing strategies and programs, as well as mobilizing financing to increase access to nutritious and healthy foods. We have adopted a multi-stakeholder, cross-sectoral, multidimensional approach which involves the engagement of multiple organizations, individuals, and organizations. And we have followed what we call a three-step approach. Analyze, where we understand what is happening at the local, regional, and global level and how they are linked. We then act based on the results that we have got from our analysis. We then bring the stakeholders together to validate the findings and also prioritize the actions and advocate for policy change as well as more financing to support further work. Thank you. So since our focus is on value chains and Pacific local food crops and fisheries value chains, we thought that we needed to emphasize that there are multiple value chains in the Pacific. And through our analysis working with farmers organizations, we have mapped a few. But one of the things that we need to focus on is that at least 20% of the food that is produced and harvested is consumed at the farm level. There are also multiple stakeholders involved in these value chains. So when we are focusing on how to leverage the development of value chains for nutrition security, for income generation, we need to take all these factors into place. So in summary, we have noticed diverse commodities going to diverse markets, local and international, regional also, diverse consumers. They fulfill many needs, and they are important for biodiversity, ecosystem sustainability, and of course, we note that the enabling environment needs to be improved. So some of the things that we have been focusing on is on strengthening the agriculture, nutrition, income nexus. And of course, Nigel will focus on the disease burden, so I will not go into that. And at the lower level, we are looking at increasing household dietary diversity, production and sale of fresh and processed local food, crops, and fish. So we have been working with the countries in developing national action plans, which start from the global to the regional policy environment, and then prioritize in sync with national policies, programs, and we have noticed the cross-cutting nature of it. So this is just to show that we need to focus not only at the global and international level, but also at the national and involve many stakeholders. So when you have time to go through the presentations a little bit more, you will see that one of the priorities for Samoa is to promote and support community-based joint initiatives that strengthen the linkage between agriculture and value chain development and nutrition and income. We have also been looking at the nutritional and health benefits of local foods. So in collaboration with USP, we have done our analysis in terms of just looking at literature, reference literature. And then we have also asked the university to analyze in the laboratory some of the bioactive compounds in selected local foods. So again, we know that Pacific Islanders are not eating enough fruit and vegetables. We have heard and being validated through the USP work that taro leaves are nutritious and important in the management of diabetes, but of course, further research is needed to validate all of these issues. And the focus of our webinar for this week and next week is on the community nutrition seed funding projects, which we have launched across all the 7 countries, except for Vanuatu. And what we did in terms of our analysis, we identified successful initiatives which were identified through the research and validated at the national level, and decided to work with these organizations to bring to use the funding that we have to reach more communities and also introduce the nutrition component. So we want to see that policymakers, practitioners, communities, and the wider society need evidence on what works at the local level in combating malnutrition. So it's not sufficient to look at the global, but also what is happening on the ground in our local communities. And we also need more budget, more financing to support the programs. So yes, we have action frameworks, but we also need to implement programs on the ground at community and household level and support multidisciplinary research involving the communities to generate the evidence. So we want to thank our co-hosts, the University of Cambridge and Exeter and University of South Pacific, and all our Pacific partners for joining with us. And we are pleased to co-host this webinar that focuses on generating the evidence. And of course, the evidence should show what impact we are having on the ground and how we can improve the situation for more greater impact on health, nutrition, wellness, and sustainability of the food systems. Thank you.
Thank you, Judith. And we are going right away into our first presentation by Nigel.
Hello, my name's Nigel Unwin. I'm a Professor of Global Public Health at the Universities of Cambridge and Exeter, and an Honorary Professor at the University of the West Indies in the Caribbean. Spent 6 years working as a Professor of Public Health. And some of the work that arose in the Caribbean was around the relationship between poor dietary quality, unsustainable food systems, and a high and increasing burden of non-communicable diseases. And these are issues that are just as relevant in the Pacific Island states as in the Caribbean. And it was through work in the Caribbean that we built collaborative relationship with colleagues at the University of the South Pacific, Pacific Community, and other places, as I'll acknowledge later in this presentation. So this talk is all around building the evidence base, the need to build the evidence base to link dietary quality, nutrition, and health in Pacific Island states. So this is what we're going to talk about in the next 20 minutes or so. We're going to briefly give an overview of the current burden of malnutrition in Pacific Island states and talk about some of the key underlying determinants of that burden. Then going to talk about the need for more evidence on the links between where people source their food, the quality of their diet, and the health outcomes associated with that. And introduce one project that's been going on in the Pacific and in the Caribbean in partnership with the Universities of Cambridge and Exeter, and that's the Community Food and Health Project, which was designed just to do that, designed to develop methods in order to start to understand better the links between food sources, particularly local food sources, and the quality of the diet. And then finally, summarize policy responses and recommendations from governments in the Pacific Islands, and in fact in small islands more generally. And this webinar, as already mentioned, will introduce the next three. And so in the next one, for example, you'll hear much more detail about the methods that were developed from the Community Food and Health Project. In the third webinar, how those methods were applied to the pilot projects in 7 countries in the Pacific Islands. So the Innovation for Agriculture in partnership with CTA. And lastly, the final webinar will talk to the policy responses in Pacific Island states and detail those much more and their recommendations. So coming first to the current burden of malnutrition. So this slide shows data from the Global Nutrition Report for 2018 for 3 regions of Oceania. And what's most striking are the high burdens of 3 types of malnutrition in Melanesia. So high, almost 50% of children having stunting of growth, alongside almost 15% showing evidence of overweight. And alongside this, a high level of anemia in women of reproductive age, around 35%, most commonly iron deficiency anemia. As you'll see, anemia is common in women of reproductive age in all 3 regions, Micronesia and Polynesia as well. Micronesia, perhaps tellingly, has no available data on stunted and overweight in children. And one might hypothesize that given the relative poverty of that region, that levels would be similar to Melanesia. And these 3 regions of Oceania have some of the highest rates of adult overweight and obesity and of diabetes in the world. So for example, what we see here is that across Melanesia, Micronesia and Polynesia, around 50 to 80% of adults are either overweight or obese. You'll see here, worth noting, that there is a difference between men and women. So going from here, for example, Melanesia, men and women with obesity and overweight and obesity rates tended to be higher in women than men. And what you'll also see from this slide as well is that this has been increasing over the past 20 years or so. So these are data for 2000 and 2016. Alongside this, we see very high rates of diabetes, the vast majority of which, over 90% of which, is type 2 diabetes. And these, as I say, are some of the highest rates in the world. In Melanesia, which has the lower rates, it's nonetheless up to 1 in 6 men and 1 in 6 women have diabetes. In Micronesia, you're looking at approaching a quarter, and in Polynesia, over a quarter or more, 1 in 4 men and women have diabetes, a huge burden. And this high burden of diabetes is indicative of a high overall premature mortality from non-communicable diseases, NCDs. And what this slide here shows is for the 7 countries that are part of the Innovation for Agriculture CTA projects. So for these 7 countries, this is showing the probability of premature mortality from a non-communicable disease. That means from cardiovascular disease, diabetes, cancer, or chronic respiratory disease. And these figures are huge. So for example, in Fiji, what this figure illustrates is that men at the age of 30, of those, over a third, 37%, at current death rates will have died before their 70th birthday. So over a third will have died from an NCD before their 70th birthday. And you'll see for women, it's around 1 in 4 in Fiji and Kiribati, 24 and 23%. And the lowest we come to, in fact, is around 1 in 6 for women in Tonga. But look at the figure for men in Tonga, over a quarter, almost a third. So this is showing a huge burden of premature mortality from non-communicable diseases. And poor nutrition plays a key role in this high burden of premature mortality. And what I'm showing here in order to illustrate that are estimates from the Global Burden of Disease study, where they've looked at 15 indicators of nutrition. And what they've done is to estimate the mortality attributable to those 15 indicators of nutrition. And this is shown us again for the 7 countries that are part of the CTA project. And I'm also showing here for comparison the figure for New Zealand. So what this is showing is the number of deaths per 100,000 population attributable to these one or more of these 15 factors, these 15 indicators of poor nutrition. And it was really striking. These figures are very large. You see here, for example, 700 deaths per 100,000 population per year in the Marshall Islands, over 600 in Fiji, Kiribati, for example, the lowest here for Samoa and Tonga. But compared to New Zealand, these figures are 3 to 4 to 5 times higher than New Zealand. Mortality that's attributable to malnutrition, to poor nutrition. And this slide now shows a proportion of deaths that are attributable to one or more of those 15 nutritional risk factors. And what's very striking here is that you'll see that around a quarter across these 7 countries, slightly less in Tonga, slightly more in somewhere like Fiji, but around a quarter of all deaths are attributable to one or more of these nutritional risk factors. So this is another way of showing the huge burden of nutritional related disease and mortality that is occurring in these Pacific Island states. So in the next section, we'll just briefly touch on some of the underlying determinants of this high burden of malnutrition and malnutrition-related disease. And the first thing to acknowledge, of course, are the real challenges that small island states face that influences, affects their ability to produce food and to be food secure, including, of course, limited landmass, increasing vulnerability to climate change and natural disasters associated with that, dependence on a small number of economic sectors, and crucially, as we'll show on the next slide, a high and increasing dependence on imported food, much of which tends to be processed or highly processed and of poor nutritional quality. And this slide here is taken from an FAO report showing the food import dependence ratio, the portion of food consumed that is imported compared to locally produced, and showing that from 1990 up to 2011, there's been this steady increase in both the Pacific and the Caribbean. Within the Pacific, for example, on average, by 2011, roughly 60%, approaching 2/3 of food that was consumed was imported. And this increasing reliance on food imports is part of a broader picture, often dubbed the nutrition transition, first so by Barry Popkin. And this is associated with dietary shifts and increasing reliance on processed and ultra-processed foods, often associated with increasing and high intakes of sugar-sweetened beverages, alongside reductions in fruits and vegetables, legumes and high-fiber staples and fish, and reduced physical activity or exercise. And alongside this as well, a loss of traditional knowledge on the nutritional value and medicinal value of local foods. So given the underlying determinants of the burden of malnutrition, the challenges obviously are considerable. I want to emphasize one area now, and that's the need for evidence on the link between where people source their food from, the quality of the diet, and health. So we've just been learning about the association between an increase in reliance on imported foods and increase in obesity, type 2 diabetes, and a very high burden of mortality from nutrition-related non-communicable diseases. One of the solutions that is proposed as part of addressing this complex is to increase nutritious local food production and obviously its consumption. And the type of evidence we need to help guide that is on the current relationship between where people source their food, where the food comes from, and the quality of their diet and their nutritional status, in other words, their health. And actually, we don't have much information on that. So in thinking about local food production, one area of interest is what we call community food production initiatives. And by that, we mean food production initiatives or businesses that are owned locally and managed locally, and which are producing food for local consumption. And that obviously distinguishes them from businesses or initiatives that are designed for export or might be owned, for example, by a multinational, a food corporation. And this obviously, promoting these types of initiatives is one approach to improving food security, in particular to improving food sovereignty, the ability, in other words, to have some control over the local food environment and food system from within the country, and to improving health, of course. However, there is limited evidence, and we've undertaken detailed review of what's been published and of the grey literature, there is limited evidence on the links between where food comes from and the risk of non-communicable diseases at an individual and household level. And so one of the challenges we took on collectively, and I'll show you our collaborators in a couple of slides, was to develop and pilot test methods to capture these types of data on the links between food source and health, on different types of food initiatives and their social and economic and environmental impacts. So the aim of the Community Food and Health Project was to develop a suite of methods for investigating the relationships between food sources, especially locally produced food, dietary quality and the risk of non-communicable diseases, and the impacts of local food production initiatives on social and economic well-being and the environment. And you'll hear more about the methods we developed in the next webinar presented by Dr. Emily Haynes, and some of the initial findings from that feasibility and pilot work. So the Community Food and Health Project was funded by a grant from the Global Challenges Research Fund in the UK, was led and coordinated by the University of Cambridge, working closely in the UK with the University of Exeter, and key collaborators for the work in the Pacific were the University of the South Pacific, and you'll hear from two members of the team in webinars 3 and 4, the Pacific community. Very grateful to the support and input from the National Food and Nutrition Centre in Fiji and from FRIEND in Fiji. And we also had partners in the Caribbean, a partner in South Africa who brought experience of studying community-based food systems in the Southern African context, and an economist from RTI International. And you'll hear more about the methods that were developed in the next webinar presented by Dr. Emily Haynes. So in the next couple of slides, I just want to give a summary of the governmental and intergovernmental policy responses to the very high burden of malnutrition that we've been looking at earlier on in this presentation, and to ways of starting to reduce that burden, some of the recommendations that come out for doing that. And these will be considered in much more detail in the 4th webinar, and how the evidence that we're helping to provide can help support and monitor those policy responses. A good place to start in considering those policy responses is at the 3rd International Meeting of Small Island Developing States that took place in Samoa and came up with the Samoa Pathway, agreeing priorities for 2030. And within that agreement was acknowledged the need to end malnutrition, the severe burden that malnutrition is causing to peoples of small island developing states. Linked to this, the need to reverse the spread and the severity of non-communicable diseases, and linked to both of those, the need to create sustainable food production systems, acknowledging that the lack of sustainable food production systems is one of the underlying drivers of continuing malnutrition and the spread of non-communicable diseases. And then from the Samoa Pathway, there was the Milan Declaration in 2015, and this was based on a meeting of ministers from small island developing states who again emphasized these needs, and for example emphasized the need to increase local agriculture and fisheries production as a way of ending malnutrition and improving and lowering the risk of NCDs. And all of this can be seen to have culminated, this and other consultations to have culminated in the Global Action Programme on Food Security and Nutrition in Small Island Developing States, published in 2017. The action programme is based around 3 pillars, and that is, the first is creating enabling environments, enabling policy environments for food security and nutrition. The second is the development of sustainable and resilient nutrition-sensitive food systems. And the third is empowering people and communities for improved food security and nutrition, enabling them to take advantage of the policy environment and of the development of sustainable and resilient nutrition-sensitive food systems. And you'll hear more about the Global Action Plan and the evidence required for it within Pacific Island states in particular in the 4th webinar. So to sum up what we've covered in this webinar, We've spoken about the high triple burden of malnutrition, referring to high rates of childhood stunting still in some parts of the Pacific Islands, alongside increasing overweight and obesity, both in children, adolescents, and adults, alongside high levels of some micronutrient deficiencies, particularly iron deficiency, manifesting itself as anemia in women of reproductive age, for example. This burden of malnutrition is causally related to high rates of non-communicable diseases, particularly those related to obesity and other forms of malnutrition, such as type 2 diabetes. And we've noted, for example, that a fifth to a third of all deaths in Pacific Island states, and we looked, if you remember, at those 7 countries in particular that are part of the CTA Innovation for Agriculture projects, a fifth to a third of all deaths are related to nutrition, which is quite something. And this, underlying this, is a high reliance on food imports. Food imports on average tend to be energy dense, highly processed or ultra processed, and changing dietary habits, an overall pattern that's been described as the nutrition transition. And then we've briefly considered some of the evidence that is required to support improving diets and improving the food system to support improved diets. And we touched on the need to understand better the links between where people source their food and the quality of their diet. And lastly, we touched on policy recognition and response. So looking, for example, at government and intergovernmental statements, the Samoa pathway recognizing the need to address the burden of malnutrition, halt the spread and reverse the spread of NCDs, and to do that partly, very strongly, through building resilient food systems. And in the next webinar, you'll hear more about efforts to build the evidence base, the types of tools that have been developed, and using those tools, then you'll hear about in the third webinar, to start to evaluate some of the interventions to improve local food production that have taken place with the CTA. And with that, I'd say thank you very much for your attention, and I hope you enjoyed this webinar, and I hope you enjoy the following 3. Thank you.
Thank you very much, Nigel. So now we will have a short Q&A session. First, I would like to invite Willy and Morgan to also quickly introduce themselves, as we haven't had the chance yet. Willy, we can hear you.
Mbula and Chalo for everyone. This is I'm Willy Amuyese, research fellow here at the Pacific Center for Environment and Sustainable Development at the University of South Pacific, based here in Suva. I'm originally from Samoa, citizen of Tuvalu, and now a resident of Suva here in Fiji. Yep, it's a privilege to do this webinar and to be a part of this program. I'm looking forward to speak to you later. Thank you.
Thank you, Willy. Morgan?
Bula, everyone. This is Morgan. I'm also with the Pacific Center for Environment and Sustainable Development here at the University of the South Pacific, based in Suva, Fiji. And we have been part of this project jointly under the CIFA project, looking at the methodological tools for assessment of the evidence base, as well as using the tools to conduct the survey with the projects in Solomon Islands and Fiji. And I look forward to interacting with you all during the webinar this evening, as well as the webinar that will come up next week. Thank you very much.
Thank you, Morgan. And we would like to invite all participants to send us their questions, or if you would like to take the mic, please raise your hand on the left panel side. We haven't got any questions as yet.
We can
So we just continue probably with the next presentation, and then after we will have your questions. So please feel free to put any comments and questions in the chat bar, and then we can have a longer Q&A at the end of the webinar. Thank you. So the next presentation will be by Emily Haynes.
Hello and welcome to webinar 2 of this series. My name is Emily. I'm a postdoctoral researcher from the University of Exeter, and I'm based in the European Centre for Environment and Human Health. I am a dietitian by background, so I have a strong interest in nutrition, particularly in the links between diet and health. And at the moment I'm working with a large international team of researchers, people from non-government and government organisations, and we are really interested in links between what we eat and how we source what we eat, and the impact on our health as well as the health of the environment. And so in this webinar, I'd just like to talk you through some of the research that we've been doing. In this webinar, I'm going to highlight the need to understand the links between sources of food and dietary quality, and also for evidence of health impacts of local food production initiatives. And then I'll briefly introduce the assessment methods and main findings from our community food and health project. Okay, so firstly, why do we think that it's important to explore links between food sources and the quality of diets? And I'll keep this brief because I know that Nigel has explained this in detail in the first webinar. But just briefly, small island developing states are where we see some of the sharpest increases in rates of obesity and related non-communicable disease. And one key reason for this is that they are more vulnerable to their food systems than other countries. And this is for a number of reasons. So historically, local agriculture has been geared towards exporting healthy food that's grown in these regions. Economies have been weakened over time by the legacy of colonialism, for example. And as the food produced locally is being exported elsewhere, we are seeing increasing reliance on imported foods, and those tend to be cheap, low in nutrients and ultra processed. And then in addition to all of this, we see environmental impacts such as extreme weather due to climate change, which impact on the capacity for producing food in these regions. So as a result, small island developing states tend to lack food sovereignty. One answer to improve food security, food sovereignty and health is to promote local community-based food production through these community-based food production initiatives. And we can define these as food production initiatives that are owned, organised and managed locally and produce either fresh or minimally processed food for local consumption. There is lots happening in many regions of the world, but we want to know more about what is their impact and how could we measure the impact of these efforts, assuming, I guess, that demonstrating impact can support or sustain these initiatives that actually work. And so we were funded by the Global Challenges Research Fund and Medical Research Council here in the UK to conduct the Community Food and Health Project, or CFAR as we call it. And we've been working on that project over the last 2 to 3 years. So the aim of the CFAR project was to develop theory and methods for evaluating the impact of community-based food initiatives on health risk, social and economic well-being and the environment. And this aim directly relates to a number of the UN Sustainable Development Goals. Our first objective was to review existing evidence on impacts of CFPIs and then go on to develop and test methods to explore, firstly, the nutritional adequacy of local diets and how CFPIs contribute, who is involved in these initiatives and any benefits that they might receive, the environmental impacts of these initiatives, and then also to determine the major challenges and successes that we could consider. We aim to answer these questions through a range of qualitative and quantitative research methods, which I will describe, and then plan to use our findings to derive and refine an evaluation framework, and then finally shape this into a programme of work that could be applied to evaluate and compare these types of initiatives in Fiji and the Caribbean, but also that could be easily modified to apply to other similar settings. Okay, so to meet our first objective of reviewing the existing evidence, we conducted a scoping review. And we found 153 articles that directly related to assessing impacts of community-based food production initiatives. We found that most of the research on this topic had been conducted in the Pacific and Caribbean, and a large proportion focused on the environmental impact of CFPIs, particularly on marine and coastal resources, and there were far fewer that reported the impacts on human health, particularly nutrition and diet-related outcomes. And so this really justified our subsequent work and led us nicely into data collection. The aim of our quantitative data collection was to apply a feasible and pragmatic approach to assess local diets with a particular focus on dietary diversity and the sources of food that were consumed. So to meet this aim, we developed a diet survey that comprised these 6 questionnaires. And these questionnaires were based on relevant, validated tools where they were available, and we used FAO and World Health Organization guidelines to inform their development. So I'll just run through each very briefly. We firstly collected basic demographic information, including gender, age, number of people living in the household. And then we included a 24-hour recall in which each individual freely recalled what they had consumed in the last 24. So once we had a record of what somebody had consumed over the last 24 hours, we applied the FAO Dietary Diversity Indicator tool. And this tool basically comprises a list of well-defined food groups, and we used that to classify the foods and drinks that each person had consumed. Once all the foods were classified, we then could sum the number of groups, and that gives us a dietary diversity score for each individual person. So say if somebody consumed foods from 6 different groups, that would indicate that they have access to a wider range of nutrients, vitamins and minerals than someone, say, who consumed foods from 2 groups. And the good thing about this tool is that it provides this score, which is a nice comparable number for analysis purposes. And for some subgroups, it can also be used to indicate whether somebody is actually meeting the minimum dietary diversity for health. The next questionnaire was a dietary screener where we asked a series of questions about specific types of food that we know are associated with disease, such as fruit and veg that reduces risk, and highly processed foods or sugar-sweetened drinks, perhaps, that increase risk. And we also asked how often they consume those foods. So that was to just get a broader picture of dietary behaviours and patterns, a bit like a food frequency questionnaire. We used the STEP survey that's previously been implemented in Fiji to shape the questions. So there's an example here of how the survey questions looked. And you can see here on the left, we asked how many servings, for example, of fruit would you usually eat in a day? And then we used a series of show cards that we developed, like this on the right-hand side, and they helped participants and researchers to calculate the number of servings that they were having, which standardized the process a little. We also obviously wanted to gather information on food sources, and that was essential to meet the key objectives of the project. So we wanted to be able to link this with the dietary data, and so we asked where or how they sourced each type of food that they ate. Did they produce it themselves? Did they buy or borrow it or use food aid? And for example, if they bought it, where they bought it from. Do they buy from supermarkets or say a roadside stall, for example? So an example of this type of question, the person we were interviewing here has mentioned that they produce some of their food. So on the left-hand side here in blue, we've asked, okay, so what type of food do you produce yourself? And they've said that they produce root vegetables. And then on the right-hand side, they're asked how often they consume those root vegetables that they've produced. So building a broader picture of what's being eaten and where that food is coming from. For our next questionnaire, we use the FAO Food Insecurity Experience Scale, which is a validated and relevant tool to assess food insecurity. And it's a series of 8 yes/no questions about somebody's experience of access to food within the past 12 months. And it asks questions like this one at the top here. In the last 12 months, was there a time when you were worried or you would not have enough food to eat because of a lack of money or a lack of other resources? And from those 8 questions, we could calculate a score that could be used to indicate the level of food insecurity for that person. So ranging from being food secure or mild food insecurity right through to severe food insecurity. And then finally, we asked some additional demographic information, including things like education status, and with consent measured each person's height, weight, waist circumference, and blood pressure. And so the survey provided a broad picture for us to assess individuals' diets and health in these 2 settings. We aim to collect data from around 100 households in each setting. And within those households, every adult or anyone over 15 years was sampled. There were 3 to 4 pairs of data collectors administering the survey, and it was an electronic survey that was developed and displayed in REDCap, which is a data management software program, and it was collected on tablets. And the data collectors were trained, provided with a variety of resources that were available via our Moodle platform, and we also piloted the survey within our research team to ensure that it worked well before we applied it. Just to also say briefly here, this is a really important component of our tool that we developed and piloted, and it's an environmental impact assessment tool essentially. We didn't apply it in the version that I speak about today, but it is now ready to be incorporated into the next iteration of our survey. And it's really important because it aims to gather data on the impact of environmental risks on food production that we see so much of in SIDS, but also of the environmental impact of these initiatives on the environment. So hopefully you can see that, but perhaps see it a little clearer in the PDF version of the presentation that will be circulated. Okay, so now moving on to the qualitative component of our data collection. And this comprises a series of focus groups and individual stakeholder interviews. The aim of the focus groups was to understand what is influencing people's food practices, cultures and choices, and what part does locally produced food source play in this. And then the aim of the individual interviews was to better understand local food production networks and key stakeholders, and also to understand the challenges and successes of existing community-based food production initiatives, and how barriers to success might be overcome. Our participants for the focus groups were largely sampled from the same communities as our quantitative data collection, and were classified into 2 age groups. So we had 18 to 20-year-olds and then over 20-year-olds. For the stakeholder interviews, we used our connections with government, private and civil society sectors, and ensured that we included participants who represented different parts of the food chain. So that was really important, starting with local producers or farmers and working our way right through to those that are involved in, say, the marketing and retail. Okay, so to share some of our preliminary results, our diet survey was completed by 186 people in Fiji and 147 in SVG, and we can see a high proportion of those were overweight or obese. And we conducted stakeholder interviews with 33 people and 22 people in Fiji and SVG respectively. And our focus groups included over 120 people across the 2 regions. So to share a few interesting findings with you, our survey results showed that diets weren't very diverse. People did tend to consume similar types of food from the same types of food groups. And those were mainly common staples such as grains, white roots, meat and fish, and dairy foods. And when we talked with communities about their common staples, most explained that these are still often grown at home. So this might indicate, or at least help us to understand, why diets aren't very diverse. These homegrown staples are perhaps the types of foods that are most available because they're growing them themselves, and so eating them is perhaps most convenient. And I've included a quote here from one of our focus groups that shows that any questions about eating habits were often linked to food sources by our participants. So this man talks about growing staple foods such as cassava and breadfruit in the garden, and he still does that. And on this subject of home growing, we think that this method of food sourcing must be investigated further, or at least more critically, because although people spoke about home growing, our survey results indicated that the vast majority do purchase their food. Rates as high as 97% of our participants in Fiji and 93% of those from SVG. In our focus groups, many reported changes in food procurement, either observed over their own lifetime or over generations, and a change towards purchasing more from markets and supermarkets, but also an increased preference and consumption of things like bread, rice, tinned fish, meat, and fast food. And our quantitative survey indicates that this trend in purchasing is certainly the case. So this quote really nicely summarises that point, that there may be these generational differences in preferences for certain types of food. The survey also found that fruit and vegetable intake was very low compared to the public health recommendations of 5 servings a day or 35 servings a week. Some consumed less than a sixth of that. So having just 6 servings a week, less than 1 serving a day. But producing your own food was positively associated with fruit consumption in both countries. And in the focus groups, communities spoke about the barriers to producing their own food. Things like the social changes in food preferences that we've described before, but also sharing that there were limited opportunities to grow their own food, and in particular they related to this to land ownership. So we can see this come through in this nice quote here, where this woman explains that there isn't anywhere to plant, because landowners keep on bringing new families to settle in the settlement that they have taken up the spaces where we used to plant. So a really important barrier. In the 24-hour period that we asked about, far more people were consuming sugar-sweetened beverages, things like fizzy drinks, than some fruits and vegetables. And this was particularly evident in SVG. Actually, sugar-sweetened beverage consumption was greater amongst those who source their food in a small or convenience store. And this is something that future research could explore. What types of food are on offer from different food sources? So are small stores or convenience stores the places that are really offering these sugar-sweetened beverages? And we can use that, that information then to accompany any data that tells us what people are actually buying there. Okay, so what can I say that we have learned from our project to inform these community food production initiatives? And I think that we've learned that there are a number of opportunities for effective and meaningful work, but also a number of challenges, of course. One opportunity is that in these settings, food consumption is still closely linked to food production, planting and fishing, for example. And our focus group suggests that people are still growing their own staples, and then it was these foods that came out as most widely consumed in our dietary survey. So there is potential for initiatives to enhance the diversity of food that's being eaten, perhaps by enhancing the diversity of food that people can actually grow. Another opportunity, I guess, lies with how people spoke about their experiences of environmental impacts. So things such as environmental degradation and these extreme weather events, and how they impact on their health and livelihoods. But I think globally, as our impact on the environment is becoming more and more important, initiatives are becoming increasingly framed to address complex concerns. So thinking about shaping the objectives of interventions to improve health, but also reduce the impact of climate change. And so we think there's an opportunity for future applications of our tool to encompass this important factor, particularly by including our environmental impact and resilience index. However, we see that there is clearly a challenge that lies with this generational change in aspirations and preferences for food that we've seen. So there is clearly a shift in the type of foods that perhaps younger generations might want to eat or source. But there is also this broader understanding of how important local food production is for livelihoods, which presents an important opportunity to reignite interest, I guess, and passion for producing local food amongst younger generations. And finally, yes, there is a considerable challenge in that local food production is essentially shaped by equity issues. So things like not having enough time to prepare food, not having enough access to land to grow food. And so the question remains, how can initiatives that are often externally funded work in sensitive ways with communities to challenge appropriate entrenched inequalities? And so whilst our CFAR project has certainly provided interesting overviews of food sourcing and food consumption in these two regions, we can highlight that there is an importance of a collaborative approach to local food, which would require locally driven interventions to improve local food production and nutrition. The next two webinars provide an example of this, so really interesting, and the implication of these efforts for policy initiatives to improve nutrition in the Pacific region. So hopefully you can join us for those. Thank you for listening, and I hope that you're able to join us for the next webinar.
Thank you very much, Emily. And I invite now all panelists to show their video again. And of course, we invite all participants to send their questions or raise their hands. We have got one question though, and this is for all panelists, so whoever wants to jump in. But maybe for Emily first. So was there any attempt to modify the FAO tool to the local setting?
Yeah, thanks for that question. Yes, absolutely. Yeah, we saw this as something that was really important. And so we worked really closely with our colleagues at USP and also at the National Food and Nutrition Centre, and that included nutritionists and dietitians there. And they helped us to produce locally relevant resources, particularly to make sure that we had resources that enabled the people that were collecting the data to accurately classify the foods into food groups. So we developed some tables and also show cards with pictures of different types of foods that would fall under different food groups. And we made sure that way that we had included foods that were locally and seasonally available. And also another really important piece of information that came from that was we developed resources that listed the types of food that were common in mixed dishes. So when people were saying that they consumed a dish that included all different types of mixed ingredients, we had a list of the types of ingredients that were commonly in that mixed dish. So that enabled them to accurately assign that food to a food group, if that makes sense. So yeah, that was a really important part of the process of developing the tool.
Thank you, Emily. And we have one raised hand from Jemima Lako from the Fiji National University. I will unmute you now so you can raise your question. Jemima, can you hear us? We cannot hear you though. But I've seen your question, or your comment was that food sources is not the only problem, but also the quantity consumed, not just variety and diversity. So maybe somebody of the panelists wants to respond. Or Jemima, you have any more?
I could just chip in here that I completely agree, and we did try to capture the frequency or volume of foods consumed within the dietary screener component of our questionnaire. So the 24-hour recall really focused on dietary diversity, and then we tried to capture some of that frequency of consumption of selected foods, things like sugar-sweetened beverages, fruits and vegetables, processed foods, or red meat consumption, and get a bit more information about the volume and frequency of those types of food are consumed.
Thank you. And there's another comment from Jemima. Preliminary results showed that there is very low diet diversity because the dietary guideline only looks at 3 food groups for Fiji.
I think these are interesting issues that Jemima is raising, and maybe we can address them in the next webinar, because we also will invite the director of the NFNC in Fiji to respond. But I think it is critical as we go forward that we take into consideration the different food groups across the various countries, even though we want to have a standardized methodology approach. to evaluating the quantity and quality of food consumed.
And there's a question from Sashi. She's raising her hand, so we're trying to unmute you, Sashi.
Hi, can you hear me?
Yes.
Sorry, I've got a very bad throat. Hi, everybody, and thank you for that very informative seminar. I think there are key issues, like the one-off case in Fiji where it said, oh, we don't have space because of landowners. I think there are a lot of ways in which we can grow food, but we need to understand where does food preparation sit on our priority list. For example, how is the time divided with the family? We often see family members spending more time on social media, for example, or on sports or certain things, and less time in terms of food preparation. So we need to really see where does food preparation sit on the agenda. The other thing I think we need to look at is where does the role of marketing, food marketing, because it's true. We've seen even where we do food production, when we've done surveys, adults eat food produced from the gardens, but they feed the children processed food. So in their mind, the higher priority is the food that is advertised on televisions, for example. And I think that is crucial. We need to look at how is food perceived by people. In Fiji and large parts of the Pacific, food is available, but the choices they're making are different. What is influencing those choices? And that's something I think we need to look at before we're able to make more interventions that are more valuable.
Thank you, Sashi.
Any feedback from Nigel or has he gone?
I think they're still there. Nigel, would you like to give any feedback?
No, I mean, just to acknowledge what Sashi said has been very important for future understanding, and they need to research that. And maybe to say that we're working, USP is working closely with Friend, and we're working closely with Friend from this end on a new project where we will be looking at some of these issues in detail over the next 2 to 3 years that Sashi has raised, and how we can promote the links between self-food production and improved health, and the need to, as Sashi has raised, the need to understand better the dynamics within families and the nutritional knowledge that people currently have. So that will be certainly part of future work.
That is very good to hear. Are there any more questions at this point in time? If not, then we will share, of course, the presentation with the group, and you will receive the recording. And if at any point in time you have any question that comes to your mind, you can just send it to us and we will address it in the group or during the next webinar, which is next Wednesday, 26th of February in the same time. So we thank very much our panelists for joining today, and we look forward to see you next week all again. Thanks. Thank you. Yes. You want to say something?
Yeah, we really appreciate the number of people who have signed on to the webinar, and we look forward to your continued engagement. So as the co-organizers, we really appreciate the interest shown. Thank you, and see you all next week.